So welcome to the Refugee Response Team Fraser Valley East Symposium on navigating the healthcare system in the Fraser Health Region. My name is Jennifer Basu, and I'm the project manager for the RRT Fraser Valley. I'll also be moderating this session today. So first of all, I'd just like to thank everyone for taking the time to join us here. Our event today is a bit unique because we have people participating here in the room as well as online throughout the Fraser Valley. So we have representation from various settlement agencies, school districts, private sponsorship groups, divisions of family practice, and more from across the Fraser Valley. We will also be recording today's session, so all the videos will be available on our website in the coming weeks. Our program today includes 4 presentations. So I will begin by providing an overview of the Refugee Response Team Fraser Valley, as well as some information about steering refugee arrivals in the region, and also findings from our refugee reference group on healthcare access. I'm also joined by 4 representatives from Fraser Health Authority. So we have Razmeet Chani, Jean Graham, Wendy Wilson, and Mustafa Ahmed, who will each provide an overview of services available to refugees in the Fraser Health region. The presentations will be followed by a question and answer session, so I'm going to ask everyone to hold off on questions until we finish all the presentations. And both in-person and online participants will be able to ask questions and join in the dialogue. One more thing, I'd also like to acknowledge those who helped make this event a reality today. So first of all, the province of BC, who have provided funding for the Refugee Response Team Fraser Valley. Also, the City of Surrey through the Surrey Local Immigration Partnership for providing us with this room today. Also, Fraser Health Authority for taking the time to be part of our Healthcare Access Advisory Group and to be participating on this panel today. AMSA for live streaming this event and for doing the video, and then also to the RRT Fraser Valley Healthcare Access Advisory Group members who've taken time to be part of our meetings and provided input and guidance into the day. So as we all know here, navigating the healthcare system in Canada can be a challenge, especially for refugees who may arrive with limited pre-arrival healthcare, limited English language and or literacy skills, or may lack familiarity with the Canadian healthcare system. Settlement workers, private sponsors, and community volunteers are often the first point of contact for newly arrived refugees. Over the past year, we have heard from service providers and private sponsors, refugee clients, and other stakeholders about the challenges in navigating and accessing the healthcare system here in the Fraser Valley, which is why we have decided to organize this event today. We hope that the presentations will provide some clarity and information that you can bring back and use in your communities. So I'm just going to move on to the next slide. So as I said, I will start just by providing an overview of the RRT Fraser Valley, and then we will move into the different presentations and I'll introduce each one individually. So, sorry, next slide. About the Fraser Valley Refugee Response Team. So the province of BC recognized the severity of the crisis in Syria and set up one-time investment to enhance refugee programs throughout the province, as well as provide additional resources. The Fraser Valley Refugee Response Team was one of 5 teams that was set up across the province, and Diversity Community Resources Society holds the contract. So the purpose of the RRT Fraser Valley was to develop and implement a community refugee response action plan and to act as a local resource for information and communications about refugee resettlement in the following communities of the Fraser Valley: Abbotsford, Chilliwack, Delta, Langley, Maple Ridge, Pitt Meadows, Mission, and Surrey. So our membership includes representation from 25 organizations across the region. Settlement organizations, we have Fraser Health, school districts, various organizations that are involved in the resettlement of refugees. with the membership, we developed an action plan through a community consultation process, and that was done in March 2016, and the action plan itself is being implemented from April 2016 until March 2017. Through that process, we identified 6 priority issues, one of which was healthcare access. So what is the RRT Fraser Valley doing? We're gathering input from service providers, refugee clients, and stakeholders. We're compiling all this input, documenting it, and bringing forward the service needs, challenges, and issues to relevant stakeholders across the region. So again, that could be federal government, provincial government, Fraser Health, wherever it makes sense. We've also been creating resources on different topics. So again, we've been getting input throughout the region and developing information sheets, holding events like today's training event, and just doing a number of things. As I mentioned, organizing information sharing and capacity building events in the region. So in terms of refugee arrivals to BC, what we have here, I'm not going to go through all the numbers, but I wanted to highlight a couple of things about the Fraser Valley region. So in BC, there have been, I believe it was just over 3,000 Syrian refugee arrivals between November 4th, 2015 and December 31st, 2016. The Fraser Valley has received close to half of all of those refugees. So that's just something important to highlight. We've had over 1,400 Syrian refugee arrivals here in the region. So it's significantly higher than any of the other regions across the province. In terms of the breakdown of arrivals of Syrian refugees to the Fraser Valley, as you can see here on the next slide, Surrey has by far received the highest number of Syrian refugee arrivals, close to 1,000, followed by Abbotsford and then Langley. Again, one thing I really wanted to highlight that is unique about the Fraser Valley is that close to 90% of all the refugee arrivals here are government-assisted refugee arrivals. We've had quite a small number of privately sponsored and blended visa office referred refugees. So that's definitely had an impact on the ground when it comes to service needs and some of the challenges that have been coming up. And just so you know, all of these numbers are available on our website, and as we receive updated numbers, we have been updating the website as well. In terms of the demographics of Syrian refugees in the Fraser Valley, so what we've been seeing here is that there's many large families with several children. There have also been complex health issues, trauma that's starting to emerge. In terms of English language skills, it really ranges from pre-literacy to CLB2, and that doesn't mean everyone, but the majority, it's definitely been a trend here in the region. And again, we're seeing 8 years or less of formal education. In terms of, so what I've done, I've put together some of the healthcare access needs, challenges, and issues that have emerged through some of the work that we've done. What I've decided to do today is focus more on the input that we have received from refugee clients. So we organized what we called a refugee reference group and brought together refugee clients both here in Surrey and in Abbotsford to provide input on their experience accessing healthcare. So I thought I'd share some of those findings. In terms of the groups that we consulted with, there were 12 females and 12 males. In terms of age range, it really varied from 18, we had 4 respondents who were 18 to 24 years old, 13 respondents who were 25 to 44 years old, 6 respondents who were 45 to 54 years old, and 1 who was over 55. In terms of country of origin, the majority were from Syria, but we did also have respondents from Iraq, Lebanon, Afghanistan, and Eritrea. The majority of clients that we interviewed had been in Canada for less than 1 year, so they had been quite new. We did also have 3 respondents who'd been here between 1 and 3 years, and 1 respondent who'd been here for over 3 years. In terms of level of English, the majority were either beginner or intermediate, and we did also have 2 respondents who were at an advanced level. In terms of what we heard, so what they were saying is language is the biggest barrier to accessing healthcare services. That came up over and over again. Also, what they did say was that the healthcare system is difficult to navigate without assistance from sponsors, settlement workers, volunteers, or friends. So the majority did get assistance, and it did make it easier, but without that help, it would have been very challenging. And then we did also hear that the dental system is a bit more challenging or more difficult to navigate than the medical system. We also heard that they found the wait times were long, especially in ER and for specialist appointments. And there was also some confusion about what is covered under the interim federal health program, as well as the medical services plan of BC. And despite the challenges, most respondents did say that they found the medical and dental services good and helpful once they were able to access them. They also provided some recommendations to us. I think some may be easier to implement than others, but I did want to share them. So one of them was just to have more doctors, interpreters, and volunteers available. They did find that a lot of doctors are really busy. It can be really hard to get appointments. Appointments are really rushed, so there's a need for that. Also, another recommendation is fewer referrals and shorter wait times for services. So in some cases, they found that they would see a doctor, then there'd be a referral to a specialist, then they'd get there, there'd be a referral to maybe another specialist or back to the family physician, and they would go in circles sometimes with wait times in between each one, so it could be quite a while to get the services that they need. Also, there was a recommendation to have some specialized clinics outside of Vancouver. So the examples that came up were a bridge clinic and an autism clinic, to maybe have some of those resources in the Fraser Valley. There was also a suggestion for a health information line with services in first language. I do believe some of that is available through 811, but that did come up. And also just have access to transportation to get to and from appointments, because especially here in the Fraser Valley, it can be more difficult to get around. So next slide. We did actually, I will include a bit of information that we got from service providers and stakeholders. So we have collected information through a number of surveys. Also, we have, as I mentioned, a healthcare access advisory group, and we've been collecting input that way. And we've also had full membership meetings, and there are some of the service needs that come up through those meetings. Again, there's quite a bit of information. We've been sharing that through different reports. I didn't want to spend too much time on this, but again, I thought I would just summarize some of the input that came up. So again, what we've been hearing is that it continues to be a challenge for refugees to access, and I've got the whole long list here, so emergency services in hospitals, family physicians, medical specialists, dentists, pharmacies, mental health trauma services, professional interpretation for medical services, and transportation. So through our online surveys, we have been asking respondents to indicate whether they feel that this is a challenge in their communities. We wanted to hear if this was a one-off or if this is a trend in the region. And with all of these, it's definitely a trend in the region. For each of these areas, we've had at least 50%, often 80 to 90% of respondents saying that they do agree that these are all the challenges. And in many cases, they've seen some improvements, but it's usually about a quarter to a third of respondents are seeing improvements in this area. So it's something I think we all still need to work on. In terms of recommendations, so again, these are things that have come up through our various surveys. We've been hearing that we need to ensure that there's adequate medical and dental services and supports for refugees in place. Also, more funding is needed for interpreters and interpretation services, and more funding for mental health and trauma services. And I think with the last point, it's something that's starting to emerge more and more as the first group of Syrian refugees that arrived that have now been here for a year, and they're maybe more settled. They may have found housing, have their children in school, and this is when the mental health and trauma services there really is a need more and more in the community. We've also been hearing about there's a need for support for healthcare professionals in registering for the interim federal health program. So I know there's been a number of groups that have been doing this work over the past year, and again, they have seen improvements, but this is still coming up. And then also too, just to provide education to refugees on healthcare services in the Fraser Valley. So through this event, we're hoping to be able to provide this information so you can bring that back in your communities and work with the clients that you serve in your communities.